Hello, my name is Deborah Jenkins. I will be doing a comprehensive exam on my patient. Mr. Holden Jenkins has agreed to do this. It is a recorded, event, sir. Do you give us permission for that?
Yes, ma'am.
I am also his guardian, and I give permission for him to participate. So let's get started. Have you already used the restroom, sir?
Yes, ma'am.
All right, let me wash my hands and let's get started. Okay, so what we're going to do is jump right in. We're going to look at your skin, looking for any moisture, dryness, and we're looking for the temperature. What we're going to do when we take a look at his scalp, we're going to palpate his scalp. We're looking at his hair for texture, distribution, and any type of hair loss. So I'm going to come right here and take a quick look, and that looks good. Moving right along, we're looking at his head and face, looking at the color, shape, symmetry, looking to see if there's any discharge, looking at the vascularity, and no obvious nodules, nodes. Sorry, that's swollen. We're going to look at his face. I'm going to look at his expression. Please smile, frown, raise your eyebrows, and close your eyes. I'd like you to smile. Open your eyes, sir. Smile. Puff off your cheeks. Okay, when you smile, can you please show some teeth? Thank you, sir. The other thing, when looking at his expression, I was looking for symmetry. I was looking to see if there was any mask or any edema. There is none. When I looked at his head, again, I was looking for contour, any tenderness. There was none. And I was also looking for any sensory loss. Could you feel that?
Yes, ma'am.
Okay, very good. Moving right on to his eyes, which is cranial number 2. What we're going to do is do a Snellen test. I'm going to start from 6 feet. Please cover one of your eyes, sir. Please read for the purpose of this test, this is 6 feet. Please read the last letter as best as you can.
LTFPH.
Again.
LTFPH.
Please cover the other eye.
LTFPH.
When I look at his eyes, I don't see any swelling. I don't see any discharge. I don't see any bruising, no obvious lesions, or any type of ulceration. Okay, moving right on. We're going to also, right now at this time, we're going to assess for direct and consensual, and as well as for accommodation. Accommodation is where we'll be looking for any change in lens and shape of his eye. For direct, what I'm going to ask him to do, I'd like you to look at my ear, sir. And I'm going to do shine a light. I'm looking to see the reactivity of his pupil. So that's direct. For consensual, I want to shine a light. I want to see in one eye to see if the other one reacts. And for accommodation, what I'm looking to see, look at this light, sir. And for accommodation, what I'm looking to see, okay, and there were no changes in his pupils. No change in the shape. The other thing we're going to do right now, we're going to continue to assess his field, looking for, we're going to look to see any convergence, any nystagmus, and any eyelid, which will be cranial nerve 3, 4, and 6. I'm going to shine this light, and I'm going to ask you to follow the light, and what I'm looking to see, just follow the light. And I don't see any of his eyes straying off to the left or right. Okay, I'd like you to follow my finger, sir. Okay, he doesn't have any nystagmus. I'd like you to look up, look down, okay, and look up again. What I'm looking at, negative for lid lag, his eyelids appropriately covers his sclera. So thank you for that. The other thing we're going to move on to, we're going to take a closer look at his red light reflex. Right. So, I have to come in a little closer here, sir. Sorry. Okay, so keep your eyes open as long as you can. Try not to blink. Okay. Moving right along, what we're going to do right now, we're going to look at his ears. And what I am looking at is for symmetry, looking at both his ears, looking for the deformities, lumps, or lesions. When I look into his ear, I'm looking for the redness, looking for the appearance of his tympanic membrane, looking to make sure there isn't no type of drainage or any type of foreign body. Any problems with either ear, sir?
No, ma'am.
Touch your head 1 second for me, sir. And what I'm looking for, I can see his tympanic membrane. It's nice and pretty white. I can also see his cone of light. Okay, I can also see what I'm seeing is a little bit of wax or cerumen. But again, you can see his tympanic membrane. It's nice and curly white. You can actually see the cone of light as well. Moving right along, what we're going to do is do the whisper test. And what I'm going to do is I'm going to ask you to cover your ear, your left ear. And I'm going to whisper to you, and I'd like you to whisper what you heard, okay?
Yes, ma'am.
Monday.
Monday.
Okay, cover the other ear.
Wednesday.
Very good. The other things we'd like to do is move on to his nose. What I'm going to be looking for is any lesions, deformity, any obstruction, any bleeding, exudate, polyps, any type of deviation or perforation. Take a look. All right. Actually, his nose hairs are clean. That's good. So, thank you for that. Meanwhile, what we're going to do is I'll move on to his mouth and jaw. When I look at his lips, I don't see any, because there's no change in pigment. There is no nodules that I can tell of. What I am going to also do at this time is look at his mouth and gums. I'd like you to open your mouth for me, sir. What I'm doing is looking at color. I'm also going to look for his tongue, which is cranial nerve 12. So got your tongue? Okay, open your mouth. Ah. Barely can see his tonsils. Say ah. Thank you. What I do, I see his uvula move up, which is appropriate. When I looked at his gums and teeth, okay, ah. Okay, no looseness. Actually, no missing teeth, no looseness, no bleeding gums, no retractions. We're also going to actually look at your gag reflex. It says them already in the mouth. And your gag reflex is going to be cranial nerve 9 and 10. Ah. Okay, thank you so much. Okay. Left to right. Okay, and the other thing we're going to do is I am going to actually have you clench your jaw, which is cranial nerve 5, and I'm going to also palpate right there his temporal mandible jaw again, looking to hear any decrepitous and his masseter jaw. I'd like you to clench the jaws. Very good. Clench jaws. Very good. Just clench them quietly. Okay. Thank you. Any pain there? All right. Cool. There is no swelling, no deformity. It looks as though he has range of motion when he opens his mouth. Close. Any pain when you did that? Okay, cool. All right, moving right along. What we're going to do now is go to his elbow. And what I'd like you to do is V, which is going to be, I want you to flex. Look at me, sir. No? Right. Extend. Bring it in front. Right, bend your elbow, right, and extend. Very good. Thank you. Now what I'm going to do is bend it again, and I'm going to apply some resistance. You pull back. Good job. Also, I'd like you to do is inspect his shoulders. I'm looking at his scapula. I'd like you to wing it back for me. Very good. Looking at his contouring and color. Extend forward for me. Okay, bring this arm back for me. Bend it back, and what I'm looking at, bend your arm back, I'm looking at to see the wing of his scapula. Thank you. Okay, so there was no deformities when you did that, no atrophy that I can see. For flexion, I'm going to ask you to raise your hand in front of you and over your head, up, there you go. Front and then up. Front and then up. Very good. I'd like you to raise your arm again and push it behind you. And then put your arms and come back like this. Very good. I'd like you to raise your arms like this. I duck and bring it down which is adduct. Okay, very good. All right, so now I'd like you to place your hand behind your shoulder to touch your back. Very good. Next, put your hand down. I'd also like you to put your hand behind it so you're combing your hair, combing back. Very good. I'd like you to do nose to finger. I'd like you to do use your finger, touch your nose, and then touch my finger. Now I'd like you to bring your arm up like this. Touch your finger, tip, 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 tip. Thank you, sir, very well. So, what I'd like to do right now, we're going to probably have to do some palpitations. So, what I am going to do is, would you step down and step to the door for me, please, sir? Yes, ma'am. All right. What I'd like you to do right now is have a seat right there. And I'd like you to bend your knee for me. Together, okay? Okay, good. Now I'd like you to extend that knee out. Okay, good. Now I'd like you to hold your knee and swing. Hold your knee and kind of swing it. No. Leave the knee straight. There you go. Do the other leg for me, sir. All right. Now I would like you to do to point your foot and plant it to the floor. Up to the floor. All right. Now I'd like you to point your foot to the ceiling. No, foot down. And then toes. Keep your foot down and then ceiling. There you go. Toes to the ceiling. Very good. All right. Now I'd like you to bend your heel. You see your heel? Raise your feet. Now I want you to put your heel up and out. Very good. Just the heel. You could literally feel you moving the heel. Thank you, sir. Now I'd like you to touch your heel to the shin and move your heel. Put your heel, cross your heel over to your shin and move that up all the way to your knee. Very good. Down. Next. All the way up to your knee and down. Very good. I'd like you to please stand. And I'd like you to go in the corner. I'd like you to work heel to toe, please. Very good. Stop. Please return to the corner. I'd like you to hop in place. Okay, very good. I'd like you to shallow bend your knee. Yeah, just shallow bend, just a slight bend. Thank you, sir. Stand up. Now I'd like you to step out a little more and pretend you were sitting in a chair. Kind of deep, put your butt in deeply, a little deeper. Now stand up without any help. Very good. I'd like you to stand up with your legs closed. I'd like you to just close your eyes and stand there. Stand there for a duration of 30 seconds. Thank you. I'd like you to open your eyes for me. I'd like you to extend your hands with your arms up. Eyes closed. And then you also stand like that for 30 seconds. Thank you. Put your hands down. And I'd like you to stand with your eyes. The first time, was your eyes open? Yeah. Okay. Just stand there with your eyes regularly open. Very good. So, all right. What I'd like you to do now is stand there and bend and touch your toes as far as you can bend. Thank you. Kind of move over to the side for me, okay? I'd like you to bend back as far as possible. Watch your head. Thank you. I'd like you to rotate to the sides, like your upper body. Very good. And I'd like you to do side to side. All right. I'd like you to turn around for me. And what I'm going to look at is at your spinal process, looking for any deformities, tenderness, and at this time, I will take this time, if I look at your spinal process, I will take this time to assess for your CVA, for any CVA tenderness. What I'm looking for is where his spine meets and where the end of his 12th, sorry? Thank you. The spine of his 12th rib. So this is going to be right about here. So what I'm looking at is this area right here, this border right here. So this is where I'm going to actually put my hand at the top, and I'm going to ask him, are you feeling any pain? And what I'm doing is assessing for any CVA tenderness. Now as he turns around, like would you have one second for me? And what I'm going to do is I'm looking at his extremities. Can the camera see that? What I'm looking for his extremities, I'm looking at hair distribution. I'm looking at the color. I'm looking to see if there's any swelling, any bulging, any bruising, any type of deformities or mass. I'm also feeling for his pulses. Feeling for his open earlobes, feeling for his popliteal. This would be his femoral here. This will be his popliteal. This will be his dorsalis pedis. And this will be his posterior dorsalis pedis. Both legs. Okay, and that is femoral right there. Okay, sir. At this time, I'd like you to return to the table for me. And I thank you very much. No peripheral edema, no tenderness. So right now what we're going to do is switch to the abdomen. I'd like you to lay down and put your head right here for me. Okay. Now when I look at the abdomen, I'm looking at the natural contouring of his stomach. Very good. I'm looking at the color, I'm looking at symmetry. I'm looking for any obvious mask or deformities. And right now what I'm looking at, I don't see any rash bulges, any striations. What I am looking for is any bowel sounds. What I'm going to do is quickly assess for his left side, right side. So I'm going to listen right down here for his aorta, his iliac 1 centimeter across from the midline of the aorta. Come on down here beneath, right beneath his umbilicus, which is going to be his iliac, because aorta, renal, iliac, 1 centimeter away from the midline beneath the umbilicus on both sides, and then his femoral right there. Okay. The other thing I'm going to look for is his liver. So his liver is going to be here on this side right here. I'll be assessing for any type of bruise or any type of venous rub. Spleen is going to be on this side. Liver is going to be right under here, this contouring section right here. What we're going to do, okay, so at this point in time, what I'm going to do is I am going to, let's go ahead and percuss all quadrants, percuss, palpate, quadrant tenderness. Okay, so we're going to percuss. I'm going to palpate. That was when I listened to this. I was actually listening to his stomach. Listen for epigastric. Percuss means I'm going to actually, this is your left side, this is your right side. Okay. Okay, I'm looking for tympany and dullness over his organs. Alright, so what I'm going to do now is I am going to have him just turn a little over this way. Turn towards this way, sir. Matter of fact, I know, you're a little uncomfortable, I'm sorry. Alright, so this is 1 inch. Is there any pain there, sir? Okay, good. Kind of turn slightly to the side for me. I'm trying to feel for an enlarged spleen, and there's nothing there. So, any discomfort, sir? Okay, thank you. Alright, so we did that. And we did CVAs on this. At this point in time, what I'd like you to do now, sir, is to extend, bring your knee to your chest. Okay? And then back out again. Alright? Now what I'd like you to do is what we're going to do is I'd like you to bend your knee. Okay? And after you bend your knee, then I want you to kind of bend your knee, and then lower it. Stretch your legs out for me. Straighten out your legs. Okay, so I want you to bend your knee, and then cross over here for your midline, and out. Now, I want you to extend, out. Same thing, bend your knee, cross right here, and then back out. Alright, very good. I'd like you now to bend your knee, and then bend your knee, open out, all right? You just bend your knee so you can move it out. Okay, good. I'd like you to turn over to your stomach, please. All right, very good. I want you to bend, flex your knee, bring it up, and up, up, good. Thank you, down, stop, down, do the other one, up, down, very good. Thank you, turn around for me. Turn around, sir. Let me just see your knee real quick. And what I'm going to be doing is checking your patella to see if there's any type of fluid in there. All right. You can actually shift this way for me. And what I'm going to do is I'm going to press down. There's no fluid. I'm also going to press up. If there was fluid, it would raise the patella, so negative any type of swelling. Okay, right now what we'd like to do is look at your neck. And what I'm going to do is I'm looking to see, when I look at your neck, I don't see any type of visual swollen lymph nodes. I don't see any jugular venous pressure. So what I'm going to do is I'm going to just I look at your trachea and I come down here. There's no deviation. So very good, sir. So what I'm going to do now, we did do that. We did do your back reflex color. What I'd like to do is palpate your thyroid. I'm looking at the size, the symmetry of the tenderness. I'd like you to swallow again. Okay, I'm going to check the resistance against your neck and shoulder. Okay. Okay, very good. What I'd like to do is we're going to palpate your nodules. This is your preocular, postocular, the occipital, tonsillar, submandibular, submental, anterior circle, posterior. Very good. So there, I'd like to move over to your chin. I'd like you to bring your chin to your chest. Good. Then look up to the ceiling. Look over to your shoulder, left and right. Then I'd like you to bend. Okay. Now I'd like to listen to your. When I look at your chest, I look at the AP diameter on the side. There is no bulging of your stomach, so AP diameter is okay. So symmetrical, bilateral, symmetrical, yes. No elevation, no depression. I look at the color, look at your chest and rate. It's nice and it's unlabored. What I'm also going to look for is we're going to move into looking to your, listening to your chest. So this is aortic, pulmonic, tricuspid, mitral valve, and Erb's point right there. Very good, very good, very good. What we're going to do is palpate for your radial, your brachial, radial, brachial pulses. I don't see any tenderness anywhere. I'd like you to hold your breath. Take a deep breath for me, sir. Okay, and what I'm looking to see is that I'm looking to see about your chest, in, out, out. Okay, what I'm doing is assessing the excursion of your diaphragmatic excursion, and I don't see anything. What we're going to look very quickly is we're going to listen to your lung sounds. Also, before I do that, I'm going to look at your nails for any clubbing or any signs of cyanosis. Deep breath. Out. In. Down. Deep breath. Again. Thank you, sir. All right. There was no inadventitious sounds. And pitch, no abnormality in pitch. Okay, I'd like you to use your fingers. Hold your hand up like that. This is going to be your adduction. Separate them. Abduction. And I'm going to squeeze them. Push against. I'm trying to squeeze them to make them adduct. But you see, they always open back out. Okay, very good. Other thing we're going to look at is your grip strength. Hold my hand, two hands. Okay. Very good. Good job. Thank you for that. And what I'm going to do is, we did the abduction, we did the adduction. Now, fingers and fingers, bring your fingers together, and then fingers apart. Thank you, sir. So now what I'd like you to do, put your palm down, point it to the, very good. Now I want you to do, put your fingers up, very good. Now I want you to bring, hold on, your palms down, fingers to your midline, okay, good. We did that already, good. So now for your wrist, I want you to make a fist out, and I'm gonna try to push down. You pull your arm up, sir. Very good. What I'm gonna try to do is to bring your wrist again into a flex, okay, good. And I'm gonna try to strengthen your elbow, good. Palms up, down, sorry, then palms up. Very good. So now what we're gonna move into is looking at your muscles. So far since I've assessed you, I don't see any symmetry, any atrophy. So for you, I'd like you to sit there. I'd like you to raise your leg and knees together. Raise it. Don't raise it. Try to raise one. Sorry. Okay. Raise one. Raise one. Okay, good. Thank you. Raise this other one. Okay, good. Now I'm going to try to hold it in. You try to. I'm going to try to pull it out. You try to
push it in.
Yeah, you try to push it in. Okay, good. I'm going to try to push your knees together. Strong. All right, very good. Now what I'd like you to do is, I'd like to put your hands on the side. We already did that. There you go. Push your knees together. Now I'd like you to straighten hands on your shin. Extend right here. And what I'm going to do is I'm going to ask you to straighten it. Okay. Okay, pull down. And no, I'm not going to try to push down. Straighten it. Can she see that? I don't think she can see that.
Okay, this way.
Thank you. Good. No, you gotta kind of handle that. Okay. Okay. All right. Straighten up. Okay. And straighten up. And okay, maybe you can either have a seat right there. There you go.
All right.
All right, so hold your knee, your leg up. No, straighten it out, okay? I'm trying to put your hands down. Force your legs down, right? Very good. Now I'm gonna try to push it down, pull it up. All right, good. Thank you, sir. Okay, so now we've already did the dorsiflex. Put your both feet up. Put your both feet like you're on a gas pedal, like push it down. I don't think she can see it. Okay. That's it. And now just bring it like on top of your tippy toes. Just do like this. There you go. Both like your gas pedals. Very good. Very good. And what I'd like you to do is we're gonna try the knee jerk. No, I'm gonna come to you, sir. For your knee jerk. But actually, come on. Sit down. Alright. Right there back to the patella. Okay. Alright. Can she see? Oh boy. And come on back for me. This way. Just the dangle over here for me. There you go. Okay. And what I'm looking is hitting the Achilles tendon dangle. Okay. Thank you. All right. Take this handle. All right.
Sorry.
Okay. Sorry. All right. So what we're gonna do is move to your sensory test. Okay. Remember with your biceps, I want you to flex your arms down. No, like this. Up, down, okay? Down, okay? And right here. Okay, just put your arm like that, okay? There you go. Sorry. All right. So what we're gonna do now is do your sensory test. What I'd like you to open is open your eye, your hands, and I want to tell me what it is. What it is I work at. Okay. What number was that?
Number 5.
Okay. Cool. Now I want you to close your eyes, and I'm going to touch you. And where did I touch you? Okay.
Shoulder.
Close your eyes.
The shoulder.
Okay. Close your eyes.
My calf.
Okay. Close your eyes.
Back and the bottom of my foot.
All right. What I'm going to do is,
30 minutes.
thank you. What I'm going to do is close your eyes 1 second. All right. Close your eyes and tell me what this is. What does it feel like? Close your eyes.
A hairpin.
Very good. Keep your eyes closed. This hand, tell me what this is.
Like a nail.
Very good. All right. All right. Very good. Now I would like you to tell me, can you feel this? Close your eyes. Close your eyes, sir. Can you feel that?
Mm-hmm.
What did you feel?
Soft like cotton.
Very good. Now I want you to tell me what's cold and what's hot, okay?
Smell. Cold. Hot. Cold.
Okay, it's okay. What's that?
Cold.
Okay. Okay, cool. What's that?
Hot.
Very good. What's this?
Hot.
Very good. What's this?
Hot.
Very good. What's that?
Cold.
Okay.
Hot.
Very good. All right, so we're going to do vibrations. See the answer. Feel that? Okay. Now I need to know, close your eyes. Tell me what this feels like. Pain?
Pin.
Pain?
Mm-hmm.
All right, cool. All right, so now I need to see your fingers. And tell me how many prips you feel. 1 or 2?
2.
No. How much between now?
1.
How many pricks you feel now?
2.
How much now?
1.
And how much now?
2.
Very good. Okay, so what we will do now is, 1 second, sir. All right, the last thing I would like to do is ask you, is this a prick or a touch? Close your eyes. Is that a prick or a touch?
Prick.
What's that?
Touch. Prick. Touch. Prick. Touch. Prick. Touch. Prick.
All right. It's 10:04.
30 minutes.
Thank you for helping me with this exam, sir.
Yes, ma'am.
Okay.